An Introduction to Health Commons, a project of Science Commons, Collaborix, CommerceNet, and the Public Library of Science. The way that we find drugs, cure disease, and manage our health isn't working. Let's take the example of riverblindness. This is a picture of the black fly. It carries a parasite that causes the disease known as riverblindness, which currently infects 18 million people worldwide. 300,000 of those people have permanently lost their sight. Most of these people live in countries below the poverty line, and although there is a drug that's available, it has to be taken over a very long time period, which is impractical in the developing world, and does not actually kill the adult worm. Now, if we wanted to go from basic information about this disease, its genes, and its functionality, to a drug, on average, we would have to assume a cost of about $1 billion and a time frame of about 17 years. This financial reality means that not only is there no good cure for riverblindness, no business can afford to look, and as such businesses focus on the diseases that are likely to yield great returns, such as obesity, erectile dysfunction, and hair loss. Globally, over 1 billion people suffer from neglected tropical diseases like riverblindness. Closer to home, 6 to 8% of our population suffers from what are known as rare and orphan diseases, a total of more than 7,000 disorders, again, none having enough people that any business can afford to make it its focus. Now, this is the result of many factors, but in particular it's the result of the persistent uncertainty in the drug discovery process. Despite the apparent linearity of the process, like in this graph, the discovery process is in reality much more uncertain. There are profound knowledge gaps. We don't know how drugs work. We don't know how toxicity works in the liver. We don't even know how Tylenol works. There are system process failures in the way that we manage and exploit information. And there are incredibly high transaction costs to doing science, from acquiring model animals like mice to managing the sea of data that's on the public web. And this translates into a series of lost opportunities in human health. Now, we have looked at problems like knowledge gaps, process failures, and transaction costs before, and it's important to look for inspiration to places where we have successfully solved these problems. And one such place is the network. So the network has revolutionized the way that we live. It's revolutionized the way that we find information. We're very accustomed to getting accurate results to complicated searches on the web. It's changed the way we shop. We take for granted that we can go on the internet and find books of interest to us, even remote foods of interest to us, or something as arcane as a Pez dispenser. And it's revolutionized the way that we sign agreements as well. We're not accustomed to high transaction costs and contracts on the internet. But it hasn't revolutionized the way that we do science, and as a result, the network works far better for queries having to do with shopping than to do with human health. So it's now time to bring the same revolutions to the science processes that the network brought to the business processes through e-commerce. Science has undergone a series of technical revolutions, like high-throughput robotics, the miniaturized parallel experiments that we take for granted in our laboratories today. And technically, we've watched data change from something that's inherently analog to something that's inherently digital. But these technical revolutions were not accompanied by process revolutions, so that a funder of science in Huntington's disease funds 4 scientists, while a funder of science in Parkinson's disease funds 5. But despite the fact that they both work on the brain, there's no connectivity. If there is connectivity, it comes through the scientists themselves, not through the funding organizations. But a network begins to connect those funding organizations, these centers of knowledge, with the understanding that they're all looking at the same brain, and therefore they have something to benefit in sharing together. And in particular, it enables the emergence of new intermediaries that can begin to exploit the shared information across all of these areas of the brain in a way that benefits, in return, all of the funders. Now, just as the network in digital terms doesn't simply move bits around, but it moves the descriptions of bits that help us find books, the science network will move reagents, materials, data, biological samples, binary code, model animals, and indeed even drug compounds. But this dream of a network is actually being blocked by a series of barriers. So legal barriers, which create very high transaction costs, make it impractical to have an organization in the middle that brokers the information. Technical barriers that make it difficult to share information across organizations kill the network. Business barriers, high transaction costs, desires for negotiation, and competition kill the network. And social barriers, the individual competition between scientists, have a chilling effect as well. until it's every scientist working alone. Thankfully, we can look again to the e-commerce revolution and see that the process revolution we want to create in science requires the emergence of new institutions. And so, although it's something we want, it's not going to happen by accident. It will happen through good design, just as the internet happened through good design and the web happened through good design choices. And that's where we come in at the Health Commons. The Health Commons is a project of CommerceNet, Science Commons, the Public Library of Science, and Collaborix. And what we're doing is network engineering for science processes. And our goal is to bring again the same sorts of value increase and revolutions to science that the network brought to commerce. And our goal is to create not just one network, but many networks, creating and integrating with each other until we reach the same sorts of scale for science that the internet has brought us for culture and for commerce. This requires a diligence about network design, both in terms of sharing and standardization. Just as the internet was built on shared and standard protocols, the science networks will be built on shared and standardized information, shared and standardized legal regimes, shared and standardized research tools, shared and standardized business processes, and a collaborative open source research platform that allows scientists across the world to not only share their information, but exploit it. We invite you to come join us in our network as we move forward. And we